Hi, my name is Joshua Houghton. I'm an athletic training student at the University of Texas at Arlington, and this is my clinical case report presentation over tightrope fixation for syndesmotic sprain. Syndesmotic sprains are not as common as a inverted ankle sprain. Lateral ankle sprains are not as common, but they do account for a large portion of collision sport ankle sprains, and football in particular. For this athlete, during a collision, he had an extremely plantar flexed and laterally rotated ankle, which caused pain and swelling, and upon diagnostic imaging, MRI resulted in widening of the syndesmosis and a laterally rotated talus inside the mortise. So after talking with this athlete, because of his high level of competition and the possibility of a scholarship for his sport, the doctor and athletic trainer spoke with each other and decided that a surgical intervention would be more appropriate for him to ensure that he is able to continue at a high level of competition and maintain that potential scholarship. Conservative approaches were considered, but they sometimes have more complications and they have a higher risk of re-injury, so they decided that the surgical intervention would be the better approach. For this, they decided to do the tightrope fixation. For that, they drill through the lateral ankle through the medial malleolus, and they'll insert the tightrope fixation. And upon clearing the medial malleolus, they have a button that will lock, and then they will tighten the fixation and create tension to pull the fibula and the tibia together. And then they will tie off and suture the tightrope fixation. This is less invasive and provides gives a more positive long-term result for the intervention. So upon completing rehabilitation, the athlete was progressing well, but he did have some setbacks once he returned to sport. He returned to sport about 6 to 8 weeks, which is good timing comparative with the conservative approaches. But he did have some hesitancies in his own self, which caused him to have some setbacks. And then his physical therapist reduced his clearance so that he could address his strength and stability concerns that he was having. After this, he re-entered full return to play, and he has not had any issues since. Considering there are less complications that are likely to arise from a surgical intervention, this is a good possibility for those who want to maintain or return to a high level of competition. With a conservative approach, syndesmotic sprain may allow an athlete to return to play sooner, but a minimally invasive procedure such as the tightrope fixation can provide a more stable solution with less risk of further complications. Thank you.